Can you see
So,
the screen?
yes, I can see your slide. Yeah. So I can see Deepa ma'am also here. Good morning, ma'am.
Good morning.
Okay. So I'm happy to welcome Deepa ma'am. So before we welcome, I think eagerly we have people from 4 centers. People are eagerly waiting for you. And add on to the recent new center is Tidal Neo, which is in Pondicherry. So now we become 5 center, ma'am. So one is in headquarters, which is in Chennai. So people will be listening you on DC Live radio platform. So if they have any further question, they'll join with you on the live, ma'am. So I'll give you intro with them also to you. If they have any question at the end of the segment, they'll connect us. So before we kickstart the show, I'm supposed to welcome Deepa ma'am, but as she was, camera was on, I started talking to her as usual. So anyhow, I'm happy to welcome. Good morning, everyone. And we are delighted to welcome Dr. Deepa Avadhani, Assistant Professor and Consultant Neurologist at Aishwarya Hospital. With over 13 years of experience in neurology and rehabilitation medicine, she specialized in treating neurological disorder, epilepsy, movement disorder, and headache. A distinguished academic and a research doctor, Avadhani has presented her work at national and international conference, is a member of prestigious organizations including the American Academy of Neurology and the Indian Academy of Neurology. Driven by her belief in empowering patients through experts and empathy, she continues to make a meaningful impact in the field of neurological care. We are honored to have her with us today. Let us give us a Deepa Avadhani a warm welcome to our show. Welcome you, ma'am.
Thank you, Mrs.
Yeah, and also a special thanks to you and Ravi, because we continuously have dedicated doctors from Aishwarya Hospital every month. And apart from the busy schedule, they are spending 1 hour with us. We are very, very happy to have you on the floor, ma'am. Thank you so much.
Thank you. Actually, I'm Dr. Deepa Avadhani, a senior consultant neurologist, and I'm a headache specialist. And my main areas of interest are memory, cognition, and Parkinson's disease, and movement disorders, as you already mentioned. So, and I'm a very academically oriented and clinician as well. So, this is very interesting for me to speak about brain and spine health, especially in this era where everybody is sitting in front of the computer, irrespective of their profession. See, we being doctors, we are also in front of computer. We not be
before we move, I just want to add on. When I was giving you intro, I also came to know that you studied in Karnataka. Your MBBS you did in Karnataka. Is it so much?
Yes.
So we have center in Karnataka, Udupi districts, Kapur districts. We have audience from there. So they also speak Kannada and Hindi. And I'm so happy that you can speak 3 languages, Kannada, Hindi, and Tamil with us. So I think today the zone going to be more comfortable to talk with you at the end of the Q&A session, ma'am.
Definitely. And I would like to be an interactive session more than a monotonous session. So
beautiful.
Any question, it may not be related to what I'm speaking. If they have any question related to neurological health, in the sense brain, spine, nerves, all these things come under neurology. So if they have any questions pertaining to any ailment, they can definitely feel free to ask me, and I will be delighted to answer their queries.
Great, ma'am. Beautiful. Over to you, ma'am. I won't disturb. Continue. Thank you.
So in this era, it's very important that we take care of our brain and spine, because the very nature of our existence stems from brain and spine. So brain is a software which runs our life. Everybody knows that. And unfortunately, whatever is happening, the accelerated change that is happening in the external world, it is directly affecting our brain. Whatever we are doing daily, we see reels, we see the screen constantly. Every minute, the brain health is getting affected. So let's start our talk today with the general neurological topics. The first thing I would like to tell is, whenever it comes to brain health, the most neglected part is headache. People think that it is okay to have headache. It is okay to have headache, and they think it is definitely normal to have headache. The thing is, headache can be of n number of reasons. So I would like you to know that all headaches are not migraines. So whenever we tell headache, what people usually think is migraine. So this is a migraine. Any headache for that matter, people come to my OPD telling that I have migraine. எனக்கு மைக்ரைன் இருக்குன்னு தான் வருவாங்க. பட் ஆக்சுவலி அவங்களுக்கு மைக்ரைன் இருந்திருக்காது. They won't be suffering from migraine because migraine has become such a common layman term. It is everybody seem to have a fantasy towards it and they call themselves a migrainer. But the thing is, yariki headache vandalo, there are few things which needs to be taken care. So first we need to understand that headache can be of multiple types. So one-sided headache, ore side la headache irukku, one pakka matra headache ide irtandre, it is not always migraine. Migraine can happen both the sides also. It can come. And how migraine usually presents is it has a genetic basis. If mother is having ammanige idre makkalige barbahudu. I mean, if the mother is having, the child can get it. Or the thing is, it is more common in females as compared to males. But males can definitely get headache. Other things I'm seeing nowadays is poor male man comes to OPD and the wife seems to deny that the person is having migraine. But migraine, it can come in males also. So please give that credit to your male colleagues because they do suffer from migraine. But in migraine, what is the problem with migraine is if you do all the investigations, say you do CT brain, you do MRI brain, everything will come normal. And surrounding people, be it a family or a professional colleagues, they seem to neglect it, saying that, okay, after all, it's a headache. No, you know what? In the world, migraine is the second most common reason for people living with, like there is some index known as years lived with disability. So this is the second most common cause. You know what is the first most common cause? It is a neck pain and back pain. So these seem to be very, very small problems because the imaging as such is not giving us a bigger diagnosis. But it definitely affects a person's life. Slowly, it drains their energy. They are not able to put their performance. They can't do their daily activities to the normalcy. So sometimes the migraine is so severe that they'll land up in emergency and we'll have to give them the IV medicine. That is known as status migrainosis. So when it comes to migraine, generally it is a one-sided headache associated with some nausea feeling, vomiting feeling, and then you have this some kind of aura symptoms. Aura means before the migraine starts, they will have some kind of flashes of light in front of their eyes or epigastric, the abdominal discomfort. All these things are there, and after the migraine gets over, there will be some post-migraine symptoms which are like, generalized tiredness, or again, some kind of visual symptoms can come after the migraine episode gets over. So migraine can be very, very mild, or it can be very severe. But my request to every one of you is any headache for that matter should be consulted and taken care. Because if you intervene at the right time, we can prevent it to going to the severe extent. Nowadays, people are aware and that they need to consult a neurologist if they have headache. But what generally happens is headache is treated by everyone, and most of the time, when you miss the diagnosis, then there is a problem. So you can only give the treatment when the diagnosis is right. See, now what happens is every unilateral headache, means one-sided headache, is labeled as migraine and given the medications. But one-sided headache can be other types like trigeminal. There's a condition known as trigeminal autonomic cephalalgias. There's a condition known as cluster headache. So all these things can also come in as present as a unilateral, one-sided headache, which most of the time are misdiagnosed as migraine. And then there is another type known as tension type headache, where the headache is coming both the sides and it is very pressurizing. Again, it affects the daily activities. So cluster headache will be sometimes, it will be so severe that the person will feel like committing suicide. The headache can go to any extent. So there are advanced treatment for some migraines and all. If the migraine is not getting subsided by all the medications like oral and other injectable medications, We do have other intervention treatment for migraine, which is the last resort we keep. That is the Botox injections and nerve blocks. It's not coming. So Botox injection and the nerve blocks, and that can be given. And one more thing I would like to tell is everybody should know when the headache is a dangerous symptom, because even in a person who is a known migraine, all the time the headache may not indicate that he is having a migraine episode. It may not be so. So the red flag signs one should look for are, one is if the headache is sudden, the sudden severe headache, sometimes it feels like a worst headache of the lifetime, then it is, definitely the neuroimaging, that is MRI of the brain is necessary to rule out any severe diagnosis like hemorrhage inside the brain, means bleeding inside the brain. Second is, whenever the headache is associated with some symptoms like deviation of facial deviation, facial asymmetry, or you have something like one-sided weakness in the sense difficulty in lifting hands and legs, or something like this is there, then also it indicates that something is really abnormal. Maybe it is a stroke or a tumor inside. And if the headache is associated with fever, see, headache with fever can indicate that there is some central nervous system infection which may be causing this. Then you have this any headache in an older age person. A new headache after the age of 50 years should not be neglected and should be evaluated. And then you have the headache is happening in a pregnant woman or a person who has just delivered, like a postpartum person getting a headache should not be neglected, and definitely it can indicate a clot inside the brain. So and also if the headache has a positional variation, suppose after bending the headache is increasing, all these things should not be neglected. Positional variation also should be taken into account. And any associated symptoms with headache, like headache with generalized tiredness, headache with fever, as I already mentioned, these things can indicate a grave diagnosis. So that time definitely you should not hesitate in getting a scan done. So first of all, when it comes to headache, it is very common nowadays in people who work in front of the computers, and it can be a mild diagnosis to a severe diagnosis, but the presenting symptom will be headache, and any headache should be consulted by the headache should be seen by a neurologist and headache specialist, and accordingly the evaluation needs to be done. And for resistant migraines, we do have Botox and nerve blocks. This is what I wanted to convey regarding headache. And next thing which is faced by the IT professionals and more modern generation is vertigo and dizziness. See, any dizziness for that matter, people explain like dizziness, giddiness, or balance abnormalities, or difficulty in standing, the unsteadiness of gait. All these things can indicate that there is an underlying neurological problem. And most of the time, this dizziness is caused by a peripheral balance disorder. In the sense, see, there are balance disorders here. Balance means it involves the nerves, it involves the eyes, it involves your brain, it involves the balance nerve, and then the vestibular apparatus, that is the balance apparatus. In this, anything is having problem, it will present as balance issues. And in the elderly, balance issues can be an indication that the person is having Parkinson's disease. So any vertigo or dizziness should not be neglected. And like headache, this is being taken very lightly by the people, and they think it is okay to have dizziness because initially it will not cause much problem for them. But any dizziness, my humble request, should not be neglected, and it has to be evaluated. And whenever there is a dizziness, then we need to see why it is coming. When we point out to the structure which is getting involved, then the treatment is very easy. The most of the diseases are benign in the sense that the underlying cause is treatable, and in very, very few cases it may not be treatable. That is, the percentage is very less, maybe 3 to 5%. So we should give importance to these symptoms, because these things become refractory, then we may not be able to treat them adequately. So, and one more misconception what people have is, if they have vertigo, it is always an ear problem. See, ear has both, it's for both hearing as well as balance. Hearing is the main function of the ear, and the balance nerve ends in the ear with a balance apparatus, vestibular apparatus. And the people who have hearing loss can also have the balance problem. But there are some balance nerve issues like vestibular neuritis, and then you have some brainstem conditions like multiple sclerosis, stroke, and all that can lead to balance abnormalities. And it is always better to get evaluated by a neurologist when you have a dizziness or vertigo, so that you get a whole picture. And we here in our hospital, we do the complete evaluation. We have a specialized testing for vertigo with the posturography, and we test and we find out exactly where is the problem, and accordingly we give the medications as well as vestibular rehabilitation. In the sense, the exercises for each structure is different. If you put in the YouTube and things like that, you get a lot of exercises, but it's not how it is done. For each structure, there's a tailored exercise. So based on that, we need to treat. Then only the recurrence can be prevented. So the other important thing nowadays people facing is brain fog. Brain fog, or brain fog is basically a cognitive problem. See, cognition is the main ability which our brain possesses, and this is what makes us different from other animals. So nowadays what's happening is memory problems are becoming rampant. So memory problem, the spectrum extends from mild brain fog to severe dementia. So see, what is cognition is our ability to perform higher order functions like language, memory, executive function, social cognition. All these things come under cognition. So your attention ability, everything comes in that, and visuospatial orientation. All these things come under cognition. So I've just put memory because everyone knows about memory. So in brain fog, what happens is people are not able to focus. They're not able to pay attention to what they're doing. Their attention span is becoming lesser. You already know that it's because of what we are doing now, Instagram reels and all those things. And also what is happening is there is a decrease in retention of whatever people are reading, and people are trying to accumulate new knowledge. They're not able to do that. This I'm seeing. See, this can happen in old age naturally, but unfortunately I'm seeing in 20s and 30s that they're not able to learn new things. And this can all be maybe because of brain fog. Brain fog happens for multiple reasons. One, it can be because of hormonal changes in women. It can be because of migraine. It can be because of vitamin deficiencies. It can be because of stress. It can be because of depression, or it can be because of long hours of screen usage, which is a very common thing which is happening. And I told you the headache, dizziness, which I mentioned. There is some nowadays I'm seeing this wobbling, screen wobbling, because they are multiple screens are open and they keep shifting their gaze from one to the other. The people who are working continuously are also facing the screen dizziness, and we also rehabilitate those people by giving some set of exercises so that the dizziness goes away. And this brain fog also can come in people who work for long hours facing the screen, and shifting one screen to another. That can also cause brain fog, like lack of attention, lack of memory, lack of focus. So this can happen, but brain fog is usually a benign condition, in the sense that brain fog is nothing to be worried about, but you need evaluation. It only says that your brain health needs attention, and when you have these symptoms, like you are not able to focus, you're not able to learn new things, you're not able to give attention, you're not able to remember what has happened, then you definitely need to know what is the reason why you are having all this. For this, first is you need to consult a neurologist, and the neurologist will assess how much the brain function has got affected. in the sense that they will do the cognitive function assessment. We here have a specialized cognitive function assessments where we have manual as well as computer assisted, so that we know the processing speed and all. When we do a manual cognitive function assessment, the processing speed and all is difficult to measure, but we have a computerized version as well as a manual version. So we are exactly finding out how much function, the brain function has got affected. And based on that, for sometimes what happens, people feel that they have memory problem, they have focus problem, but when we test it, they won't be having the problem. So we first test their cognitive abilities. If indicated, if there is really a problem, then we go ahead and do the investigations to know why they are having the problem. Suppose in our preliminary screening, there is a cognitive problem like memory or attention problem or any other cognitive abilities are at stake, then we go ahead and do the investigations. The investigations include, we need to know the metabolic panel, if they are having a thyroid problem or they are having any vitamin deficiencies. These and all are treatable ones, or they are having migraine, or they are having some hormonal changes. All these things we will assess, and then we will do a scan of the brain to know any, see, this memory problem can come because of any brain tumor or any clots inside the brain. All these things can also cause memory problems. So we need to do a scan and see whether the structure of the brain is normal. And there is one other condition known as autoimmune encephalitis, where the memory and this cognition they presents as brain fog and also a seizure. And you may see a movie in that's very famous, The Brain on Fire. It's a story about a journalist in US who was misdiagnosed to have a psychiatric condition. It turned out to be a neurological condition, who had this kind of brain fog, then aggressiveness, then seizures, and people thought she is a psychiatric patient. Many a times it happens here also. These things are taken as any behavioral problem is labeled as a psychiatric problem. No, see, first you need to rule out a neurological problem, because these problems can be treated better when we treat it early, when we diagnose early. Once the most tissue is getting involved, after that the treatment may or may not be adequate, or it may not work at that point of time. So any behavioral abnormality, any brain fog symptoms, any new onset of a headache, all these things should be duly evaluated and should not be neglected as these symptoms should not be taken as granted. And this is about like brain fog. And if memory problems are consistent, definitely you need to see a neurologist. And then if the memory problems can come in young age also, and if the person is having family history of dementia like Alzheimer's dementia, then definitely they need routine screening, and they should practice some kind of games and all. They can play like chess or any Sudoku or anything, so that their more pathways can get created inside their brain. So that is one good thing they can use. See, if you are having a genetic tendency to get dementia, it's not only genetics, it is the environmental factors also. They are very important to get a dementia. So better is to socialize, better is to play these games, and better is to keep your mental state stress-free. So increased stress and depression can also lead on to dementia in a later age. Dementia is what memory problem in the old age, it's known as dementia. And then you have this sleep abnormalities. Sleep is the most important thing in anyone's life. So sleep is the time when the toxins are getting cleared out of your brain. So sleep is the best detoxifier. So if you are not able to sleep adequately, like 6 to 7 hours of sound sleep, it may not show you in the immediate life, but it will definitely predispose you to get a dementia on a later date. So if you have sleep disorders, please consult a neurologist and find out why you are having a sleep disorder, because sleep is a very, very important thing if you see from a neurology perspective. So next I would like to tell about something about neuropathy. So neuropathy, as you know, it is, see, when you have, I told you about the brain conditions and all. Now, neuropathy is the nerves. Nerves are everywhere in our body. So any symptoms like numbness, or any pricking sensation, throbbing, pricking sensation, or you have any kind of tingling sensation or vibration sensations anywhere you are feeling, then it can be because of involvement of nerves. So if it comes suddenly, like you are normal and you are getting it in a week's time, definitely this can be a dangerous neuropathic condition, which is known as Guillain-Barré syndrome, which needs immediate treatment. Otherwise, it will lead to respiratory failure, dependent on a ventilation and all. It can lead to that severe extent. But if a person is a non-diabetic or an alcohol consumption, chronic alcoholic, he gets a numbness or these symptoms over a period of time, say 1 year and all. This can be a peripheral neuropathy which needs to be treated, but it's not an emergency. So any of these symptoms should not be neglected, because once the neuropathy sets in, you need to take care. Otherwise, it can lead to difficulty in walking and difficulty in doing your regular treatment. So another main symptoms which people face nowadays is neck and low back pain, because of our posture and because of the nature of the work we are doing and the sedentary lifestyle. Neck and low back pain has become very common. In a sense, this is due to the disc disease, where because of the posture and their lifestyle nowadays. It used to be a old age problem earlier. Now we see in 20s, 30s and all, people having a significant disc problem. So how we can avoid it? One is the posture. You need to sit straight, and you need to keep your computer to the level of high, and then you need to take a break at every, it is a 20-20-20 rule. It may not be practically possible, but at least in 30 to 45 minutes, take a break, change your position, look away from the screen, and come back and do your work. And the thing is, if somebody is having neck pain or back pain, these things start very mild symptoms only, it will start. But if you do not take care at the earlier stage, it can lead on to the very severe problems, like the need for surgery, spine surgery and all. So my request to you is, if you have a neck pain, like if the neck pain is there and it is going to your shoulders or hands, or a back pain is there which is radiating to your legs, this is definitely a disc problem and it needs evaluation. And based on your scan findings, you need correct lifestyle modification as well as physiotherapy. And in extreme conditions, this can be this can lead on to paralysis and difficulty in walking, and it may need surgery also. So after these are all the common symptoms. The most serious condition which we face as a neurologist is stroke. Stroke is a very important and very common problem, and it has become very common now. See, people are aware of heart attack because it causes pain to them and they immediately come to the hospital. The chest pain is very severe to them, but stroke is something which is painless. Unless it is really debilitating, like one-sided paralysis, people do not generally seek attention. But stroke is as severe as heart attack. See, I would like you to remember one acronym, so that you know that the person around, maybe your friend or your relative, is experiencing the symptoms. Then you should know that he or she is experiencing a stroke. There was a reels which was circulated 1 year back in Delhi Metro. One police person was labeled as drunken, and it was circulated that way, drunkard and circulated that way. But unfortunately, he was suffering a stroke at that time. So if anybody who gets sudden onset of following symptoms, this person whom I mentioned was having a balance abnormality, was not able to stand steady. So unsteadiness of gait, the sudden onset of balance abnormalities. See, remember this acronym BEFAST, be fast. Any sudden onset of these symptoms can tell that the person is experiencing a stroke. B is balance abnormality. E is eye problems like vision loss or double vision. F is facial asymmetry. And if the one side of the face is not as looking as correct as the other side, then also it's a stroke. Then A is arm weakness, arm or leg weakness, difficulty in lifting arm or leg. Then you have this sudden onset of speech difficulty. T is time to call ambulance. So these symptoms should not be neglected. And one more thing is, any sudden onset of symptom for that matter should not be neglected. Some strokes are very rarely, they come as sudden onset of the numbness of one side. This is most of the time neglected because it doesn't cause any difficulty in walking. So if that is also there, then you need a MRI. So the stroke can be of two types. One is the hemorrhagic and another is ischemic. Ischemic is a more common one. And hemorrhagic stroke means there is a bleed inside the brain, which is causing all these symptoms. Ischemic means there's a clot inside the brain. Both of these strokes, the presentation is similar, what I mentioned. Those symptoms only will come. But the treatment is different for hemorrhagic and it is different for ischemic. Nowadays, people are having this because of the social media. They keep aspirin, atorvastatin and all at home. But my request is, do not give it unless you see which type of stroke it is. It may be correct for cardiac, but when somebody is experiencing this stroke and if he is having a hemorrhagic stroke, by giving aspirin, you are making the condition worse. So when somebody is having the symptoms, the first thing to do is rush to the immediate next hospital, get a CT or MRI done, and treat accordingly. So the thing is, the golden hour now, you know, if somebody is having ischemic stroke, then if you come within 4.5 hours of the symptom onset, we can give thrombolysis treatment. Means we can give clot bursting injections. Within 1 day, if there is some indications are there, if there is a block, we can do thrombectomy. So when it comes to stroke, time is brain. Like earlier you come, we save more brain tissue and the functional recovery is good. So stroke symptoms should not be neglected. Any sudden onset of any symptom for that matter, sudden onset of headache, sudden onset of dizziness, sudden onset of all other I have mentioned be fast symptoms should be given utmost priority to save the brain tissue so that the person will have a good quality of life. So now another common condition which neurologist sees is a seizure. So seizure or epilepsy. Whenever somebody is having seizure, immediately we need to see why he is having a seizure. Not all seizures are epilepsy. If somebody is getting one seizure, he is not an epileptic for life, but we need to see why he is getting a seizure. Getting a seizure is never a normal phenomena, but if somebody is getting first time seizure, it can be because of multiple conditions like any decrease in sodium levels, decrease in glucose levels, or some other reasons are there. We need to find out whether it is the treatable, reversible causes which is causing the seizure, or he is having an indigenous propensity to get seizures. And to know that, we do the MRI of the brain and we do the EEG and find out. So we need to see whether he needs a temporary treatment or he needs a treatment for lifelong. And if anybody is having a seizure, it's a myth that you should give a iron rod or something to make them, but you need to make them lie down on one side so that you prevent the aspiration. And if somebody is getting repeated seizures, do not wait for some help and all. Immediately you rush to the hospital, because every seizure is giving the brain sufficient damage so that his cognitive abilities will come down. And if the seizure is more than 5 minutes, it can be a status epilepticus, which is a neurological emergency and a life-threatening condition. So another important common thing is Parkinson's disease and movement disorder. It is usually seen in the elderly, but it can come as a young onset Parkinson's disease. If anybody is experiencing tremors or slowness of activities or balance abnormalities or any type of mood changes, sleep disturbances, stiffness, all these things can say that the person might be suffering from Parkinson's disease. And any abnormal movements also can indicate that the patient is having a movement disorder. This needs to be correctly diagnosed by the neurologist and treated accordingly. So another thing which is neglected sometimes is optic nerve disorders, like difficulty in seeing, but the patient will be able to see, but not to the extent like how he or used to see before. So if you are having vision problems, then we need to see whether it is a primary eye problem or it is coming from an optic nerve. And that time the conditions can be multiple sclerosis or benign intracranial hypertension, and all. The neurologist will evaluate and tell. And another last thing I would like to tell is all these conditions which I mentioned needs immediate acute care followed by a neuro rehabilitation. So neuro rehabilitation is about neuroplasticity. Means whenever we give some kind of physiotherapy, speech therapy, or cognitive training, the brain will get trained so that the new pathways are formed and the function which was lost due to the damage comes back. So neurorehabilitation includes this physiotherapy, speech therapy, cognitive training, etc. Depending on the underlying diagnosis, we give it to the patients. So I'd like to end my session with this. So if you have any queries related to brain, spine, and nerves, you're welcome to ask me.
Thank you, Deepa ma'am. I think the main very important points we have covered where we generally undergo with the issues, or we hear the people are facing all those things. That's what I felt it like. You covered main things where people generally want to know and should be aware of it. That is what the things I heard, ma'am. Thank you for the session. So I just give over to you, to the audience, listeners. If anybody have any question, you can unmute and feel free to talk with Deepa ma'am.
Yeah, hi Srilekha, good morning.
Hi Sabi, good morning.
Yeah, hi ma'am, good morning.
Hi, good morning.
Yeah, ma'am, you have explained very clearly. My voice is audible, ma'am?
Yes, Sabita.
Okay.
Please tell me.
Okay. Yeah, I want to know the difference between the vascular headache and the migraine, ma'am. Because recently I was diagnosed as vascular headache and also migraine. So I want to know the difference between that, and I want to know why it's coming and the symptoms of that.
Can I ask you what was the MRI image finding? What was there?
It's not an MRI, ma'am. It's just like I used to get to one side side only. I used to feel the pain, but for the last month, I have the entire head was like I can't able to tell the pain, but it was severe.
Okay.
So till the neck part. So doctor prescribed me like having the medicine for 10 days, and he mentioned that it was vascular headache. That's it.
That's all. There was no imaging, nothing done.
Yes.
Okay. See, vascular headache is, as you already know, that there is a underlying vascular malformation or aneurysm or something causing it. Or some people do write this vascular as because the last underlying mechanism of headache is a vasodilatation, means the dilatation of the arteries which causes headache. That's what they might have meant. Actual vascular headache are like there are some causes for it. So if you have not done MRI or something, it may be a migraine. So are you getting the headaches very frequently, or it is like it's a new
when I go in in the sunlight, if I see the lightings.
Okay.
So if I heard some noise that in that way, if I become stressed, in that basis I'm getting.
What I'm asking is whether this is a new onset headache or it is there since your
no, after my postpartum I got migraine, ma'am.
Okay.
And during last month I got it was severe. It was not on a regular basis, but it in between.
I would still tell that it is an atypical migraine than a vascular headache, and you need to do some kind of lifestyle as well as some kind of migraine prophylactic medicines if it is consistent and causing you your trouble for your daily activities. And but it's always better to a neuroimaging, the MRI of the brain with the venogram, to know how is the status. Because most of the time, the symptoms which is presented as headache can tell us a different diagnosis, say benign intracranial hypertension. Those are treatable and you'll be symptom free. See, why I'm telling atypical migraine is, migraine starts at the age of maybe teenage like that, but it can come in the middle age also. So if it comes like a regular teenage thing, that is known as a typical migraine. Otherwise, it is a atypical migraine. Before, I would tell vascular headache only when I get some evidence to it. So right now I would say it we need to rule out that.
Okay. Okay. Yes. Thank you, ma'am.
Yeah, thank you, Sabita. So we have Daya from Kapu. Hi, Daya.
Hi, Srilekha. Thank you very much for conducting this session. It is a it's a beautiful session. Thank you, doctor, for going through the length and explaining things. Really appreciate that. And thank you very much once again. Just a quick question that I have, or rather two questions. Since childhood, an ENT specialist suggests that I have a sinus issue. Am I audible? Is my voice quality better?
Yes,
Yes,
sir.
Daya. Yes.
Okay, so I have been diagnosed in my earlier days, probably somewhere around 96, 97, from an ENT specialist that I have a sinus issue. I am missing out on joy of life, like eating an ice cream. So anytime I eat an ice cream, the next day I immediately get a headache. Or the day when I wash my hair, unless and until I do not blow dry it, the next day again I have a headache. Or if I sit under a fan which is running at full speed, the next day I have a headache again. So I really don't know, because I'm missing out on life, like missing out on joy of eating ice creams, drinking anything cold on a hot summer day. So any way around this, doctor, that you can probably suggest, or is this something that I'm stuck in life with?
See, first, we need to see whether you really have a sinusogenic headache. Sinusogenic headache means see, if you take 10 people, we see 100 people, 80 of them will have sinus problem, once or the other in the lifetime, but not everybody will have a sinusogenic headache. Okay. Sinusogenic headache will come like when you bend, it will increase, or some
that happens as well. Yes. The eyebrows hurt, as if I feel there is heaviness in my eyebrows. Right above the eye or in the forehead part, that's where it starts hurting. Whenever I pick up something, that is when it starts hurting.
Okay. So then probably you do have a sinusogenic headache, and some breathing techniques are there, like which can help you come out of it. But to be honest, if taking ice cream or cold things, they are triggers. So one important thing I forgot to mention to people who are listening to this is that any headache, for that matter, more so for migraine, there are precipitating factors, and these factors are common as well as some factors are individualistic. See, common factors are stress, lack of sleep, and not taking food on time. These three things are common precipitators for migraine as well as many types of headaches. But there are some things like cold or coffee, or some cheese, or wine, or see, I get patients who eat prawns and get migraine precipitated. People who take chocolates, they are also very known migraine precipitators. In your case, it is only the cold, the ice cream or a cold exposure. So these precipitating, our nervous system becomes sensitive in such cases. And I do ask my patients to maintain a log where they have to write what are the precipitating factors, and they need to either avoid it or adapt to it. Avoid it because, see, cold, you can avoid it. Eating chocolates, you can avoid it, but you can't avoid sunlight. That time you have to use the umbrella or put shades. Recently, we had a campaign on shades for migraine, where people have wore the shades so that they avoid the precipitating factor. So in your case, it is cold. So you need to avoid it and practice some kind of breathing techniques. So the breathing techniques do help. The inhalation and exhalation do help in clearing your sinuses, and it may reduce. I'm not saying totally it will be cured, because the way you are explaining, it looks like you have sinusogenic headache. So it needs to be taken care, and it's not that if you treat the sinus infection or do the surgery, the headache will go away. This is another misconception people have. The surgery for sinus should be done if you have a breathing difficulty, nose block, not for the headache's sake. Okay, I think I made my point.
Yes, you did. And thank you very much. I have one other question. This is from one of our family members. So just wanted a general question. What is the best time in a day to take supplements like calcium, iron, magnesium, or vitamins? Should it be taken before a meal or after a meal, or does that even matter? or it can be had anytime during the day?
Nothing specific actually. You can take it anytime. Yeah.
Okay. All right. Thank you, doctor. Appreciate it. Thank you.
Yeah, hi, this is Priyanka.
Yeah. Hi.
Sorry, yeah. Hi, this is Priyanka. So I have a general question on migraine. Like I'm given the understanding that migraines cannot be treated but can be managed. So is it possible, like even after having medications for migraines, can the frequency reduce to like completely zero, or probably once in 6 months, something like that?
Hi. Actually, it is not that migraines cannot be treated. What basically happens is the nervous system becomes hypersensitive in a migrainer because of the genetic predisposition. So it depends. If you get a consultation or get a treatment very early, mild stage, it can even be almost cured because it's an indigenous property of the nervous system in a migrainer. I'm not using the word cured, but we have patients who are almost headache free for 1 or 2 years completely. They've not got headaches. So this can happen if we intervene at an early stage. But as you said, it is manageable, and it depends on the stage at which the treatment was started. And it's not that migraine has to be treated, all migraines have to be treated. No. See, if the migraines are very frequent, then only it needs continuous prophylactic medicines. Otherwise, it's only on and off. Whenever you get headaches, you need an SOS medicine. So our aim is to make you have less frequency of headaches. And when it comes to migraine, it is more like a lifestyle modification than actual medicines. But once it crosses some stage, then medicines also become like a 50% lifestyle and 50% medicines. So it depends on where you stand in this spectrum.
Okay, sure. Thank you.
Yeah, thank you, Priyanka. So any more questions from others? Do you have any questions?
Yeah, Srilekha. Hi, ma'am.
Yeah, Mahesh.
Yeah, Mahesh here. Yeah. So, good morning, ma'am.
Good morning.
So, one of my family member has recently have taken. She had back and neck pain, so she have taken a MRI. So the impression says that a well-defined lesion measuring 20 mm is seen in a flax in left eye parietal region, sign of meganomia. So,
Can you tell again?
ma'am, can I put it in the chat so that you can read it? Right, ma'am?
Yes, please.
Yes, Mahesh. Yes.
Okay.
Now, by the meanwhile, I mean, Mahesh is dropping the question. So there is also a question from TN centers. They're asking like, இப்போ வந்து migraine இருக்கு, normal தலைவலியும் இருக்கு, ஓகேங்களா? So ரெண்டுத்துக்கும் என்ன மாதிரி ஒரு different symptoms இருக்கும்? Is that ரெண்டுமே ஒரே symptoms மாதிரி இருக்குமா? இல்ல ரெண்டுத்துக்கு வேறுபடுமா? இல்ல sometimes வந்து என்ன feel பண்றாங்கன்னா, continuous-ஆ work பண்றோம், ஓகேங்களா? Work பண்ணிட்ட பிறகு ஒரு 8 hours, 4 hours continuous-ஆ work பண்ணிட்ட பிறகு அந்த stress-னால வர தலைவலியை அதை வந்து நாங்க எப்படி டிஃபரன்ஷியேட் பண்றது? ஏன்னா ரெகுலரா இருக்கு. ஓகே, இப்போ ஹெடேக் பிரஷரால வருதா, ஸ்ட்ரெஸ்னால வருதா, இல்ல மைக்ரேனா, இல்ல சிஸ்டம கண்டினியூஸா பாக்குறதுனால வருதா? சோ இந்த மாதிரி ஒரு கன்ஃபியூஷனை நாங்க எப்படி வந்து தவிர்க்கலாம்? How do we identify what type of headache is this? That is one common question what I received.
Okay. See, first of all, அதான் சொல்றேன் இல்லைங்களா, எல்லாருமே வந்து எந்த தலைவலி ஒத்த தலைவலினாலே மைக்ரேன் சொல்லுவாங்க. பட் அப்படி கிடையாது. Okay, there is nothing like all one-sided headaches are migraines. இப்போ migraine ன்னு சொல்றதுக்கு there should be a family history. Okay, I mean this is 90% of the migraine. The 10% are atypical that neurologists will see and tell you. But usually one-sided, unilateral, and there will be like throbbing type headache will be there. And headache வர முன்னாடி கொஞ்சம் symptoms இருக்கும். Headache ஒரு 4 hours and 3 days வரைக்கும் லாஸ்ட் ஆகும். ஹெட்டேக் முடிஞ்சப்ப ரொம்ப டயர்ட் ஆயிடும். இதுதான் மைக்ரேன் ஹெட்டேக் இப்படிதான் வரும். ஸோ நீங்க தெர் இஸ் நத்திங் லைக் நார்மல் ஹெட்டேக். அண்ட் எப்பவுமே ஒரு பர்சனுக்கு வந்து இப்போ ஒருத்தருக்கு வந்து நான் மைக்ரேன் டயக்னோஸ் பண்ணா அவங்க லைஃப் லாங் மைக்ரேன் மட்டும்தான் அவங்களுக்கு வரும்னு கிடையாது. தெர் கேன் பி மல்டிபிள் டைப்ஸ் ஆஃப் ஹெட்டேக் இன் அ சிங்கிள் பர்சன். அந்த டைம்ல உங்களுக்கு என்ன இருக்குன்னு நாங்க பார்த்துதான் உங்களுக்கு ட்ரீட்மெண்ட் கொடுக்குற மாதிரி இருக்கும். So it's not that once a migrainer is always a migrainer and no other type of headache can come to them. No, it's not like that. And for IT professionals, you need to keep this in mind, that you should keep your screen brightness lesser, and you use some retinal protection guard or something, and keep checking your refraction, because eyes are the direct mirror of the brain. So eye get strain aachuna அது directly brain க்கு தான் affect பண்ணும். So we are having job leave, நம்ம கம்ப்யூட்டர் தான் பாக்குறோம், வீட்டுக்கு போய் கூட ரீல்ஸ் தான் பாக்குறோம், அப்படி இருக்கும்போது eyes, brain, everything is getting affected.
Good. Thank you, ma'am. So Mahesh have dropped his message on the chat box, ma'am. Can you see that, ma'am? It's on your right side. You see the chat.
I am seeing well-defined measuring marks in the left hyperretinal. Yeah. Okay. Yeah, this is a benign tumor, what you have mentioned, and see, it depends on the symptom. In the symptom, what was there?
She have continuous headache and back pain, ma'am. So back pain and all.
Okay, see, continuous headache with this is, the headache may not be actually related to this, and back pain definitely it is not related to this. It is an incidental finding, but it needs regular monitoring every year to see if the size is getting increased. So it needs neurology as well as neurosurgery involvement. If the size is increasing, or if she's getting any other symptoms, then may I know her age?
It is around like 60.
60. Okay.
Yeah.
See, right now only headache is there, no other symptom is
and she will face the numbness on the left side of the left hand and the left leg as well.
Left hand and left leg.
Yeah, ma'am. Numbness is there, right?
Is she a diabetic?
Yes, ma'am.
Left hand and left leg. And is it the numbness are continuous, or it is intermittently coming?
Ma'am, it is a continuous one, ma'am. Sometimes they feel, and sometimes they don't.
The left-sided numbness is not because of this, and we need to know whether a neuropathy is there or something like that. Okay. But definitely this needs regular follow-up.
Okay, so she want to take a neurosurgeon consultant or
neurologist, and then if they suggest if the size is increasing, she may need neurosurgery consultation. Okay,
this needs to be treated on priority right now.
Yeah.
Okay.
Nothing emergency in that, but she needs a consultation.
Okay.
And this tumor is not something malignant. It will not go somewhere, and it's a very common one to have in brain, and it has a good prognosis.
Okay. I hope it is treatable also, right?
Yeah.
Okay. 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 Thank you so much.
Thanks, Mahesh. Mahesh, always feel free. Any questions, you can pin me. We have Ravi and team to help us to have a second opinion when you go to a doctor. So feel free, okay? Any thoughts? This is not only to Mahesh, to all the listeners who are there on the DC Live. So any questions, doctor-related questions, feel free to text us, and definitely we'll get the answer from the Aishwarya and team and the doctor who was guiding with us and was joining with us on the live. So don't miss out those things. Any further questions, team, you want to ask any generic question? And we also have one question from Vivek, ma'am. So Vivek has been like, that is there in the chat box. So I traveled for 50 kilometers for some personal reason. After returning home, I've been experiencing severe headache, body pain, and persistent headache, which continues even now. Even after 2 days, he got continuous headache. That's what he's saying. What could be that?
See, you have traveled and then you have getting headache. Have you taken any medicines for that?
Vivek?
No, ma'am.
You didn't take. He didn't take, ma'am.
Okay. See, obviously, at the outset, it looks like an exertional headache because you traveled and you have got headache. But even after taking a paracetamol, if your headache is persistent, then you need to evaluate, because when somebody is traveling, there will be dehydration. And the dehydration causes headache because of some important reasons like venous thrombosis, which we should not miss out. So if you take a paracetamol and see whether the headache is subsiding, otherwise take an MRI of the brain with a venogram. Do not miss diagnosis, because if we see many young people with this venous thrombosis and the presentation is headache after traveling.
Okay.
Yeah. Thank you, ma'am. So this is the final last question from our listeners, ma'am. Ma'am, now the screen time, which is unavoidable for everyone, apart from looking at the mobile screen and other time, but people working on laptop and computer, it is unavoidable, right?
Yes.
If you want to give advice to manage their, good health and neurosystem well, what could be one thing which they can do regularly to, they should not come across all these issues. What can they follow up, ma'am?
See, general advice for brain and spine health in for people who are exposed to long screen hours would be, one is your posture. Sit in a straight chair, and second would be take adequate breaks. Breaks, I do not mean a tea break or a coffee break. What I meant break is break from the screen. Like the what is famous now is 20-20-20 rule. You look 20 feet away every 20 minutes for 20 seconds. But instead, it's not practical. What I advise my patients is at least 45 minutes to 1 hour. You just look away from the screen, or you just stand up in your place, just turn around and sit back to you for your work. The second one, what I told you was this. First is posture. Second is taking breaks. Third is keeping the computer at your eye level. So what I see, like most of the neck pain happens because they are bending. They are bending and seeing, or they are some people are having in their home some setup where they look up and I don't know, in Chennai they do that, and they look up and see. That also causes neck pain. So at your level, if you can arrange, that would be nice. And the fourth thing, what I suggest is the brightness of the screen should be reduced, and doing some kind of mindfulness techniques after your work, at least for 5 to 10 minutes, would really help. There are some meditations which are for professionals, which can help in keeping your brain stress free. After all, at the end of the day, it is all accumulated stress which is leading to this kind of problems. So mindfulness techniques definitely help.
Yeah, thank you, ma'am. So we have come to an end of the session. So that's a question from us. Thank you, everyone, for listening. And it's a special thanks for Deepa Avadhani, ma'am, for joining us today and sharing your valuable insight with our listeners. Your guidance on brain health, stress management, and maintaining a healthy lifestyle in today's digital world has been truly helpful. We are grateful for your time and experts, and the wonderful having you with us on DC Live, ma'am. Thank you so much.
Thank you, and I'm also very happy that it's an interactive one. Thank you.
Thank you, ma'am. I think we need one more session with you, ma'am. Definitely will pin you with lots of questions. People who have listened to this, they may have some generic question for personally, as well as also young parents are there. So now we cannot avoid the kids, away from the mobile. So they also have some questions after listening to you. With the one more wonderful session, we'll join along with you, ma'am, again.
Definitely, yes.
Thank you so much, ma'am. Thank you so much. Thanks, Ravi. Thank you so much.
Thank you.
Thank you.
Thank you, everyone.
Yeah.
Thanks, Srilekha.
Thank you. Thank you all. So that was a wonderful DC Live segment. So stay tuned to DC Live for more segments like this interesting segment. Stay tuned to DC Live. We care, we share, and we are on air.